Good morning, everyone. I hope we're all excited to start this weekend webinar marathon. Before we begin, let me ask you, have you or your patients ever struggled with unexplained chronic symptoms that just don't seem to improve no matter what you try? If so, please type yes in the chat room. I hope you're all ready for today's critical and insightful topic. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of CE. It's my pleasure to introduce our new speaker today, Dr. Emily Rowe. Dr. Rowe is a distinguished expert who blends the best of conventional and holistic medicine. After earning her MD from the University of Miami Miller School of Medicine in 2004, she expanded her expertise by pursuing a master's degree in Chinese herbal medicine and acupuncture. Dr. Rowe's approach to medicine is unique and comprehensive, addressing the root causes of diseases through cutting-edge lab work, detoxification strategies, and ancient practices like shamanism and acupuncture. She co-founded the Miami Beach Comprehensive Wellness Center with her husband, where they specialize in treating complex chronic illnesses, including those caused by environmental toxins. Today's webinar, Mold and Mycotoxins Toxicity, TCM Strategies for Diagnosis, Treatment, and Prevention, addresses a hidden culprit behind many chronic illnesses, mold toxicity. Mold and mycotoxins can lead to a wide array of debilitating symptoms that are often overlooked by conventional medicine. Dr. Rowe will equip you with the tools to diagnose, treat, and prevent mold-related illnesses using TCM strategies. You will gain a comprehensive understanding of different types of molds, mycotoxins, and their severe health impacts, and you will have the practical techniques for using pulse and tongue diagnosis, antifungal herbs, detoxification pathways, and more to help your patients recover from this often overlooked condition. Before we begin, a quick reminder to set your chat from hosts and panelists to everyone so that everyone can be part of the conversation. If you have any questions at all during the webinar, please use the Q&A box. The quiz for CUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar, and please join me in welcoming Dr. Emily Rowe.
Hi, everyone. Thank you so much for joining me today. I am going to share the screen, and I'm really looking forward to sharing this information with you guys. Let's see, share. Okay. Can you guys see my screen? Everything's good. All right, I'll take that. That's a yes. So I just want to take, let me see if I can, here we go. I just want to take a moment to say thank you to eLotus. It's been lovely to work with Myra and her teams and Sam, and I really appreciate you providing me with this opportunity to share all of this information. There's absolutely no shortage of patients who have mold toxicity, and I promise you have some of these patients already, and this webinar, I'm hoping, will help you just get to a deeper root of what's causing all their chronic symptoms. And you know, this is a very Chinese thing. I always like to acknowledge the people who've taught me, and we're all standing on the shoulders of giants. And these are all of my major teachers. And I also like to state that my clients or patients have been the best teachers I've ever had. And especially when you have those really difficult cases where they're not responding to treatment, those are opportunities for you to become a better practitioner and to really think outside the box and wonder why they're still sick. Just a quick note, this is not a doctor-patient relationship, and none of this is individual medical advice. If you suspect you or a family member, if a patient has mold toxicity, they really need a medical evaluation. This is going to guide you to get a start in it, and a lot of these therapies are not FDA approved. That does not mean that they don't work. They work quite well. They just haven't been analyzed and approved by the FDA. And I'm not going to sell you any products in this lecture today. Okay, so here's our main learning objectives. We are going to define signs, symptoms, detoxification pathways, medical pathophysiology associated with mold and toxic burdens. We're going to talk a lot about labs, and we're going to talk about how to use binders. And you already know some binders because some Chinese medical herbs are actually binders. And then we're going to talk about herbal treatment to eradicate fungal colonization of the nasopharynx, and also the GI tract and the GU systems. And then we're going to discuss about a little bit about medical ethics and gaslighting and the safety of public buildings and whatnot. Okay, here we go. So just briefly, functional medicine, which is, the way I practice medicine, it's an amalgamation and blend of many types of medicine. But it's interesting when functional medicine was created and it's becoming more and more popular, it was actually a bunch of allopathic doctors that looked a lot at Chinese medicine and how the patterns worked. And what they did is they took Chinese medicine and they put it on top of a Western pathophysiology. And so really what it's based on is systems-based biology. And that means that, things like the endocrine molecules that are banging around in your bloodstream and the hormones that are processed in the GI tract are all connected. And you guys understand this stuff very well. But one of the things that functional medicine looks at is why are you so ill? Not just here's this pill to mask all the symptoms. Illness does not just drop on you like an anvil falling out of the sky on Wile E. Coyote. And, you'll have these patients come in and they're like, oh, I was diagnosed with rheumatoid arthritis. Well, how did this happen? Well, I don't know. The doctor says I have to take methotrexate for the rest of my life. Often there's triggers and there's things that cause this. And if you're interested in functional medicine and you're interested in, well, what was actually the thing that threw the anvil down? Where did that anvil come from? And we look at all these different issues. Diseases don't just appear. They're the sum total of an individual's expression of a lifetime of exposures to toxins, nutritional deficiencies, infections, and stressors. And so here you can see this tree, and there's all these different roots and branches. And this is just like roots and branches in Chinese medicine. So I just want to share with you quickly, Dr. Sidney Baker, he's one of the grandfathers of functional medicine. He never called it functional medicine because that term wasn't around when he was practicing. But he was a pediatrician and he saw very, very sick children. And he said, you need to figure out what you're missing and what you have too much of. So what are you missing? And replace it and figure out what you have too much of and get rid of it. So that's one of the very simple things you can think of. So what might you be missing? You might be missing sleep. What might you need to be getting rid of? Mold and mold toxins. And then each something is attack. And, the thing is your patient comes in and they have this list of complaints and they've been to 30 doctors. And so they're finally desperate and they're willing to try acupuncture, even though they're afraid of needles. And, that the idea is that these patients come in and they probably have 8 to 9 tacks that they're sitting on. And if you take out one tack, they're not going to feel 50% better. So this is, this whole 2-tack hypothesis of why we get sick. If you're sitting on 2 tacks, if you go to a Western medical doctor, they'll give you an aspirin and maybe your butt feels a little better, but you're still sitting on 2 tacks. So the proper treatment is to remove the tack. And that's what we're going to look at is one of these tacks may be mold and mycotoxins. So here's examples of tacks upon which you might be sitting. So these are all your deficiencies, nutritional deficiencies, regular circadian rhythms. Maybe you have a gene such as MTHFR where that gene needs a little extra help with detoxification. And so you have a deficient pathway for detox. Maybe you need more relaxation. Maybe you need healthy relationships, all sorts of things that you could be missing. And then here's things that might be excess, things that you might need to get rid of. Too much screen time, binge eating, alcohol. Infections are a big one. We're going to talk about Lyme disease tomorrow, which is a separate class. But today we're talking about biological toxins. All of these things are tax that you can pull out and help the patient feel better. So, when you're working with these patients, often the answer is not so simple. It's every individual is unique and different and how they respond to stuff. And like I said, these people may have 4 or 5 tacks, they may have 8 or 10 tacks. And so getting them on the road to wellness is not easy, but it's interesting, it's intellectually stimulating, and it's just so fascinating. So let's say you have a patient who comes in and they're eating all organic. They come in every week for an acupuncture. They get a massage twice a month. They're doing yoga 3 times a week, and then the gym the other days. They have a regular meditation practice, 20 minutes in the morning. They play like a visualization to help them sleep at night. They see a psychologist once a month, and they're still sick despite all of the healthy lifestyle. So you may want to consider mold, colonization, and mold toxicity. Mold is way more common than is currently recognized. And mold toxicity was first recognized in 2005 by a doctor named Richie Shoemaker. And he wrote a book called Mold Warriors. And his basic observation, he actually got into mold toxicity because he saw patients who were actually sick with biotoxin. There was a local lake and there was an algae that was producing some biological toxins that was making a lot of his patients sick. And then he started seeing mold toxicity as well. But what he recognized that is brilliant is he saw that mold affected the body's ability to detox. And when detox mechanisms shut down, then you start accumulating all these other toxins and you get a snowball of effects. So you'll start accumulating plastics and heavy metals and pesticides, and it's a spiral down to become sicker and sicker and sicker. And, it is important to remember that not everyone is susceptible to mold toxicity. So about 75% of the population, their immune system will recognize these toxins and, create antibodies, destroy them, take these toxins out. But some people genetically are not able to make antibodies to mold toxins. So they'll get very sick from mold toxins. And so, the analogy I use when people come in, because often there'll be a family of 4, one person is very sick and the other 3 are not. So they think that the sick person is crazy. There's no way it could be mold, but we all respond differently to mold and mold toxicity. And before this class started, I actually received an email. Somebody said, "Oh, I signed up for your class this weekend. How much mold can make somebody sick?" And that's different for each individual. We all respond differently. And it also has to do with what's going on in your life, what other dynamics are happening. So the analogy I use with patients, because people understand this, is peanut allergies. Some people, they eat a peanut butter jelly sandwich every day. They can't get enough peanut butter and they're fine. And other people, the person next to them has peanuts and they get an anaphylactic reaction. This is why they stopped handing out peanuts on airplanes, right? It's a common allergen anymore. But not everybody gets sick from mold. I still don't think you should be living in a water damaged building. but there is a genetic and constitutional difference. And as Chinese medicine practitioners, all of you guys understand constitution and how an exterior pathogenic factor, which is what mold is, that enters the body can have different effects on different constitutions. So here's what we just discussed, the family of 4 living in the house and only one person is sick. And then that person may be labeled as crazy or, oh, they're depressed or, oh, they need this, psychiatric medication. But mold toxicity is very real. Okay, so we're just going to go into a couple of definitions here. A fungus is a kingdom of the organ. So, there's the animal kingdom, the fungus kingdom, and whatnot. And then mold is a type of fungus. And then mycotoxins are actually toxic chemical substances that are created by molds. So when you're dealing with mold and mycotoxicity, you have to treat both the actual fungal colonization, and you also need to treat the mold toxin. So we're dealing with 2 different things here. And I just want to briefly let you know that there's a lot of politics involved in this. And, when I left allopathic medicine, I was relieved because there was this distinct hierarchy. And I really didn't like all the politics of medicine. But then when I went into alternative medicine, I found that there's still politics there. And you will navigate and negotiate with this. And if you're really interested you may study with some of these different schools of mold illness. So there's 5 main schools of mold illness or perspectives. And the first is the conventional medicine view, is that mycotoxins are not a big deal. And they recognize mold as an allergy. You can be allergic to mold. And you go see an allergist and it shows up on a skin test. And then the other thing is super sick patients who are in the ICU can have like sepsis with candidiasis and stuff like that. But other than that, mold illness doesn't exist. And then this is Dr. Shoemaker. I told you about his book, Mold Warriors. He also wrote a book called Surviving Mold. And he mostly uses a medication called cholestyramine, which is a bile acid sequestrant. And what bile acid sequestrants are, they're binders. They bind to toxins so that you poop them out. And he saw several patients who had clusters of symptoms. And he also looked at inflammatory markers in the blood. And he has this thing called the visual contrast test. He's super focused on medications. He doesn't believe in any sort of alternative medicine. And he also does not use urinary mycotoxin testing. And then this is Dr. Camel, who runs a lab called My Myco Lab. This lab is getting more and more popular over the past few years. And he's the medical director for My Myco Lab, and he looks at antibodies against mycotoxins. And he also doesn't believe in urinary mycotoxin testing. And he says binders are useless, whereas Dr. Shoemaker says cholestyramine is a binder. And he gives a large amount of antifungal medications, mostly itraconazole. Oh, there's a typo. We should have an E at the end there. My apologies about that. And then I studied with Dr. Neil Nathan. He is a very kind person. He actually used to teach at an acupuncture school, and he loves acupuncture. He uses urinary mycotoxins as the cornerstone for diagnosing mold toxicity. He uses a broad range of binder regimens, nutritional and dietary therapies, and he's takes a truly integrated approach to medicine. Now, one thing he says is he doesn't believe mold toxins in food contribute to illness, and that all of the mold illness is due to water damaged buildings. And then this is Dr. Pejman, and he's a lovely pediatrician in California. And he studied with all the previous people that I showed, Dr. Shoemaker, Dr. Campbell, and Dr. Nathan. And he's a medical colleague of mine. He has a free YouTube channel. You should check out his YouTube channel. All of his stuff is based towards children. And he says, look, I only have experience with pediatrics. But he says that, mold is part of it, but it's not just mold. And he actually calls mold toxicity environmentally induced gut mediated endotoxicity, because what happens is you lose intestinal permeability, that you basically develop leaky gut, you get changes in the microbiome and perpetual inflammation driven by mast cells, and a loss of tolerance, a loss of immune competence, and then you develop endotoxemia, which is internal chronic toxemia of the GI tract that is perpetually making you sick. I think all of these practitioners have some validity, and it's interesting to hear the debates among these guys. So just I can see if there's any quick questions so far. Questions in the Q&A box. Let me take a look. Let's keep going. All right. So how does mold toxicity occur? So usually mold toxin illness occurs when someone is living or working in a water damaged building. And it may, the mold may not be visible. The mold can be hidden in the walls. My husband and I both got sick from mold toxicity, but everything was internal within the walls and you couldn't see anything, nor could we smell anything. So, here's the thing. If you have water, so clearly this is somebody's ceiling, there's a leak coming down, you can see there's water damage, and these brown spots here, this is mold growing from the water damage. And probably if you remove the ceiling within the crawl space between the levels, you're going to find a ton of mold growing. And so what'll happen is the mold starts releasing spores, but the mold also releases mycotoxins. So the spores are microscopic and you can breathe them in, and you can also breathe in mold fragments, these tiny pieces of actual living mold, and you can get colonized in your nasopharynx and GI tract. So here's another example of mold. This looks like apartments I lived in while I was in college. And I've definitely stayed in Airbnbs, opened up underneath the sink, and it looks like this. There was clearly water damage and things weren't remediated properly. So here's an example of what happens. You're breathing in these mold spores and also fragments of mold, and it can colonize the nasopharynx, which is the sinuses, the nose, all of this. The posterior throat, you'll see a thick, greasy tongue coating whenever somebody's colonized with mold. And this can include candidiasis, fusarium, aspergillus, all sorts of stuff. And then what'll happen is the whole GI tract can get colonized from there. And then once the colonization occurs, the fungus actually creates a biofilm. And so biofilms are basically the mold is making a condominium to set up camp inside your body. And the easiest everyday biofilm that you've probably seen, like let's say you go to Trader Joe's, you buy groceries, and there's some very nice roses on sale. So you buy roses and 2 weeks later they're dead and you throw them out and there's all this slime in the water. That slime is biofilm, and that the bacteria that grow that the water's been sitting in have generated that biofilm. And so biofilms in the body it's a barrier that's like thick and mucilaginous, and it'll prevent antifungal medications and herbs from getting directly to the fungus. So it makes the fungus harder to eradicate. And so one of the things you need to do is give a biofilm breaker. It's basically a strong holding fort of defense. And there's some very interesting studies about fungal biofilms and how they affect immunity. There's some thoughts that fungal biofilms can trigger autoimmune reactions. And then there's some thoughts that it can actually cause immune depletion as well. I've seen both, and I think, again, it depends on the constitution of the patient. But really, the biofilms are protecting the fungal pathogenic factor. And so what can happen then is if you don't treat the biofilms and people are just taking all these antifungal heavy duty medications, you'll get a drug resistant persister cells that are hidden within the biofilms. And they're going to evade the immune system because the immune cells can't get there either. And this can trigger alteration of cytokine profiles. And this is part of what mediates the gut mediated endotoxin cycles that make kids sick, as described by Dr. Pejman. Most of this has been studied in Aspergillus, Cryptococcus, Candidiasis, and Fusarium, which are all different types of molds. Okay, now we're going to talk about the actual toxins that molds produce. So the term mold toxin and mycotoxin are interchangeable. And basically, once the body is colonized with fungus, the fungus will produce these mycotoxins. And they're odorless poisons, and they can have all sorts of various effects on the body. These are some examples. There's ochratoxins, trichothecenes, aflatoxins, mycophenolic acid, zearalenone, gliotoxin, citrinin. We're going to briefly discuss all of these. But the important thing is one thing that can happen is when you start to actually treat mold and try to kill the fungal colonization, the mold will fight back. And the way it fights back is by releasing mycotoxins. It tries to make the patient feel so bad that they stop treating. And so people will come in and they'll be like, oh, I took itraconazole and I feel so bad. And the key to this is binders, because binders bind the mold toxins so that you can get rid of them. But it's kind of like, imagine those spaghetti westerns, where at the last scene is this big shootout. This is kind of what the mold is doing. It's a last hold attempt to hang on to the colonization, is to produce more and more mycotoxins. So sometimes once you start treating somebody and you check urinary mycotoxins, the mycotoxins levels will increase. So this is the medical fancy definition of mycotoxins. They're secondary metabolites produced by fungus that are capable of causing disease and death in humans and other animals. Because of their pharmacological activity, some mycotoxins or mycotoxin derivatives have found use as antibiotics, growth promotants, and all other kinds of drugs. And still others have been implicated as chemical warfare agents. So we'll talk briefly about which of these are used for what. So mycotoxins, so these are the actual mold toxins, can cause impairment and detoxification, immune depletion, pretty significant neurocognitive issues, hormonal imbalances, GI tract dysregulation, respiratory issues, and chronic sinusitis. So, and this is one of the most important things that mold does, is it breaks down detox, and the toxins just start accumulating. So you'll get this spiral down into illness. We talked about this earlier, but it's good to repeat it because this is why it's so important to treat mold toxicity, is because otherwise all these other toxins will just accumulate. And until you actually eradicate the mold, you just keep increasing the toxic burden further and further and further. In addition to jamming up the detoxification mechanisms, a lot of the molds will impair the immune system. And then what you can happen is you get reactivation of old infections. I've had patients come in and they have recurrent shingles. or chronic Epstein-Barr. They've been seeing, a functional medicine doctor for years, chronic Epstein-Barr. The other one that is not looked at enough is cytomegalovirus. I actually find that to be see much worse symptoms than Epstein-Barr, and a lot of people don't test and look for it. There's going to be increased susceptibility to long COVID. My sickest long COVID patients often had mold toxicity. And then when you get exposure to mold, you can also get reactivation of old infections like Lyme, Babesia, Bartonella, Mycoplasma pneumonia, and chlamydia pneumonia. And this chlamydia is a lung infection. It's not the sexually transmitted disease. That's a different type of chlamydia. But you can reactivate all of these infections, and so the patient can be very sick. It'll also inflame the brain. Mold toxins, if you look at the chemical structure, it's all these benzene rings, and they're fat soluble. And the basic rule in chemistry is like dissolves like. So mold toxins will actually deposit into your brain and neurological system. And so one of the treatments that we'll talk about later is phosphatidylcholine. Phosphatidylcholine is in the membranes of all of your cells, but especially your nerves and your brain. And by giving things like phosphatidylcholine, which is a healthy fat that's derived from things like sunflowers, oil, phosphatidylcholine helps bump off the bad toxins that are dissolved in the fat, and it gives you like a membrane transplant for your brain and your cells. And because these toxins can deposit into the brain, you can get all sorts of weird neurological symptoms. So I've had patients come in and they've got twitching of muscles, or they're told, oh, I saw this neurologist and he diagnosed me with benign fasciculation syndrome. Well, that's BS. It's probably mold toxicity or another toxin like heavy metals. There can be severe sensitivity to touch, weird paresthesias, a lot of mood swings, a metallic taste in the mouth is not uncommon. And then one thing that is pathognomonic of mold toxicity is ice pick or lightning bolt type of sensations. And I've had a lot of patients come in with like kind of ice pick headaches, like the cluster headache kind of picture. And it's actually mold colonizing the sinuses. And I'm going to teach you ways to treat this as an acupuncturist. Mold will also screw up your GI tract, and it can be a factor in weight gain. Your gallbladder and your liver is really what processes the hormones in your body. And then these get released into the intestines. But what'll happen when you have a bunch of mold toxins, the liver and the gallbladder can only work so hard. And they will prioritize, oh, this is public enemy number one. So they'll prioritize whatever's most toxic first. And when that happens, other things like estrogen will accumulate. So you might see some estrogen dominance because your liver and gallbladder are so busy getting out the mold toxins that they can't get rid of the estrogens. And think about plastics. Plastics are fake estrogens, right? We call them xenoestrogens. And think of all the ramifications of plastic in the body. They're risk factors for diabetes, for all sorts of stuff. But when you have this elevated toxic burden disrupting the function of the liver and gallbladder and the intestines, you get accumulation of hormones. And elevated levels of estrogen in women are a risk factor for breast cancer. In men, they're a risk factor for prostate cancer. And then you can get weight gain. And then it's just like this huge cascade that can happen. Chronic sinusitis, respiratory issues. Some people have a chronic cough, chest discomfort, shortness of breath. You can actually get fungal balls that grow inside of one of the sinuses. And there you can see these sometimes on imaging studies. Aspergillus especially is known for causing fungal balls. And this happens when you breathe in the fragments of mold and it just decides to set up camp inside your sinuses. There's actually a mold doctor in Atlanta. His name is Dr. Dennis, and he's an ear, nose, and throat specialist, and he specializes in treating mold toxicity, and he does a in-office sinus surgery where he removes these fungal balls. That's kind of his specialty. And then if you go to the World Health Organization, they have some really interesting information on mold toxins in foods. So they say mycotoxins are naturally occurring toxins produced by molds and found in food. And they're found on a variety of different crops and foodstuff, including cereals, nuts, spices, dried fruits, apples, coffee. And, you know, if you think of like all these grains, they're often stored in silos and there's no temperature control. So if there's a hot, humid condition, mold can easily grow on the grains. And coffee in particular is known for having mold toxicity. And, you know, the health effects are real and they can range from acute poisoning to long-term effects such as immune deficiency and cancer. So these are just examples of some crops where aspergillus will commonly grow on them. All your cereals, your oils, your seed oils, spices that are commonly have mold growing on them, tree nuts, and then the toxins can also be found in animal milk who are given these feeds that have the mold toxins. So if the cows are fed corn and the corn has aspergillus growing in it, the cows will have the mold toxins in the milk. So I think this is part of why you'll have patients who come in and they say, oh, I cut out grains and I feel so much better. That is a clinical cue that, gee, maybe I need to test them for mold toxicity. And, you know, ochratoxin A in particular is known to have toxic effects in animals, but also people. It can affect fetal development and the immune system, and it can damage the kidneys. Ochratoxin A is a mold toxin that is a known carcinogen as well. I've had a couple patients who come in who have had recurrence of cancer and their ochratoxin A levels are very high, and helping to detox the ochratoxin A is part of their treatment for cancer. So this is what the World Health Organization recommends to minimize your risk for mycotoxins, that, you know, inspect your foods. And if anything is moldy, discolored, or shriveled, throw it out. Avoid damage to grains by storing them properly. You want to store them in a cool, dry place. And then buy grains and nuts as fresh as possible. And make sure to don't keep foods for extended periods of time before being used. I'm in Florida. We're approaching the end of hurricane season. I had my hurricane supplies in the closet, but I'll eat them this winter so that they're not sitting there again next year for the next hurricane season. It's important to clean that stuff out. And then a common question is, can mold toxins be destroyed by cooking? No, you can't get rid of them by cooking. They're still present. Boiling water will kill mold, but the actual mold toxins are still present. And dead mold, even if it's dead, can still provoke allergic reactions, IgE reactions. And some molds, especially the spores, can survive cooking, frying, and freezing. They're pretty remarkable. You've got to have deep respect for mold. Okay. Do we have any questions in the chat? Let's see here. Q&A. There's one question. I'm just going to stop and read the question here. Oh, I can't pull it up. I'm going to stop the share briefly. I just want to check in before we go to this next thing. Okay, here's a question from Dr. Paul E. Robbins. Will the biofilm affect the lymphatic system? When juicing, I have someone that emits a lot of mucus in her BMs. Yeah, no, if she's having a lot of mucus, that could be the biofilm being eradicated from the GI tract. Um, I don't know the answer to the question about how biofilms affect the lymphatic system. But yeah, that's a very interesting question. I don't know the answer, but it's interesting to think about. I mean, if you take TCM and do a pattern differentiation for what biofilms are, it's really phlegm, right? It's accumulation of phlegm. So a lot of your formulas to treat phlegm will help to eradicate the biofilms. Okay, what about ozonating? If you clean foods with ozonated water, will that break down mycotoxins? So yes, ozone will treat mold toxins for sure. But the problem with ozonation is you need so much of it that the people and animals need to leave the room. So I actually have an ozone machine that I run in my office when I leave work, and then in our house as well when I'm not home. But you cannot run ozone when pets are present. And I like ozonated water. I don't think it's strong enough to actually kill mycotoxins. But it would be interesting to do a study where you actually tested the grains, ozonated them, and said, oh, this percentage died. So, all right. I'm going to go back to any other questions you guys want to type in the chat while we take this break. Otherwise, we can go on to the next portion. Okay, great. Keep the questions coming. It keeps it very interesting and me on my toes. I'm going to go back here to the slides. All right. So here's the clinical presentation of mold and mycotoxins. So the patient comes in, they've seen all these different doctors, all of my labs are normal. Every time I've tried a medication, it doesn't help. And often they have multiple diagnoses, right? And sometimes they have no diagnosis at all, but all of them have been told it's all in your head. So here's common symptoms. You get fatigue and weakness, often worse with exertion, all sorts of brain fog, trouble finding words, poor memory, chronic sinus, headaches of any type, sore throat, metallic taste. Sometimes they can't describe a metallic taste. Sometimes they'll just say, I have this weird taste in my mouth. It's kind of like sour, kind of like garbage. That's kind of a clinical hint. Oh, I need to test for mold. Shortness of breath, any sort of asthma, chronic cough, with or without phlegm. It can be a dry cough. Some people, it'll be a mucus producing cough. Palpitations, heart arrhythmias, GI disturbance, basically all sorts of GI stuff. Any unusual pains, random stabbing ice pick sensations, that's an electric shocks. Frequent urination, often at night, because mold is a yin pathogen. And we'll talk about the energetics of mold. And then you'll see excessive thirst as well. They'll have weight changes, hormonal changes, so skin rashes, and weird neurological symptoms. So I had a patient who came in to see me who said, I thought I had Parkinson's. I went to the doctor. They did all these neurological tests, but all of my symptoms are only on the left side. And they said Parkinson's cannot occur only on the left side. Or they'll have a tremor or numbness, tingling. Dysautonomia is dysregulation of the autonomic nervous system. So anything that your body is supposed to do automatically. So your whole sympathetic, parasympathetic gets dysfunctional. So patients will have trouble with blood sugar regulation because that's under autonomic control. Blood pressure will be all over the place. It'll be both high and low. And they'll have issues with temperature regulation. They're cold, then they're hot, then their fingers are freezing, and they just can't regulate their temperature. That's a type of dysautonomia. That's something your autonomic nervous system is supposed to regulate. Night sweats, unusual smelling sweat. And then the sickest patients, of course, cannot sweat at all. You can develop a sensitivity to chemicals, light, sound, touch, electromagnetic fields, um, mood symptoms of all sorts. And I have seen pretty bad obsessive compulsive disorder get triggered by mold, particularly gliotoxin. And they'll just have this general existential dread. I feel like I'm dying, they say. I don't know what's wrong. Personality changes, all sorts of stuff. These are diagnoses that you might see in these patients. Of course, chronic fatigue syndrome, fibromyalgia, um, neurological problems like Parkinson's, Alzheimer's, allergies, sinus stuff, multiple chemical sensitivity, EMF sensitivity. In kids, there's a huge component of mold with ADHD. Dr. Pejman, these are the children he treats he's over in Los Angeles. He's treating autistic and ADHD kids, and a lot of them have mold toxicity. Autoimmune diseases, cancers, as I was saying before, ochratoxin is a cancer. Liver issues, fatty liver, lung cancers, breast cancers, preeclampsia and adverse pregnancy outcomes can be associated with all sorts of elevated levels of mycotoxins as well. So if you have a pregnant lady, it is safe to give them binders. In fact, it is safer to give them binders than to not give them binders. So one of the things you can ask your patients is, if the patient comes in, or even if you've known the patient for years, have you ever lived or worked in a place that has water damage? And people say no. I was like, well, did you ever have a leak? Leaky pipes, a leaky roof, a wet basement, bathroom, any musty or moldy smells. Because mold can grow in 48 hours. It doesn't even have to be an old building. So I am in Miami. That's where I live. And then I practice in Miami Beach. But one thing that'll happen frequently here is we'll have a bad storm come through and people will lose power for a couple days. And when the power goes out for a couple days, it's hot, it's humid, the AC is not running, and all of this moisture will condense and sit inside the air duct vents, and mold will start growing. Even without the water damage from the storm. So just having the power out for prolonged periods of time can trigger mold growth in the HVAC system of places. And then one of the questions you can ask is, are you better when you're out of this environment? Oh, I feel great every time I, go to my beach house and leave my regular home. And then one of the other key things is if the symptoms are worse in the morning, often, there's mold that in their house and they've been sleeping for 8 hours and just breathing in mold fragments and spores. Other clues that you need to do some testing for mold is unusual neurological symptoms, chronic sinusitis, all your GI tract issues, all these things that we talked about. Living in a hot, humid climate. So here I am in Miami, Florida. Mold loves growing in Florida, and a lot of the Florida houses were built for quick money. And they're not sustainable. And we get some storms and there's damage to multiple buildings. And then the contractors can't come and repair for several months. So people are living in these water damaged homes. So we see this a lot here in Miami. Repetitive use of antibiotics. So if somebody has had chronic ear infections as a child, and I took antibiotics like once a month for 10 years for ear infections, that's a sign that they might be colonized with mold. And then excessive cravings for carbohydrates, because the carbs basically feed the molds. And anytime you have somebody who's on a carbitarian diet, like, I'm a vegetarian, all I eat is Snickers and pasta, that's a sign that they might have mold. I was a vegetarian for years and eating way too much carbs, and it contributed to my own mold toxicity. And then, there's an old term for it that you may have heard, sick building syndrome. often, people were diagnosed with sick building syndrome. Sometimes it was asbestos, but I suspect that sometimes it's actually mold toxicity. Another clinical hint, severe sensitivity to any kind of smells. So if you get into a elevator with somebody and they're wearing perfume and you get an instant headache and want to vomit, well, maybe their perfume's gross, right? Cotton candy gutter sluts perfume. But maybe your olfactory system is inflamed and overreactive because you have mold toxicity. So, a lot of these chemicals, yes, they're very bad. They're toxic. We all know that. Thank God I'm preaching to the choir here. You guys know all about this stuff. But with mold toxicity, you'll get extreme reactivity to this. So you'll get headache, nausea. You smell somebody snuggled dryer sheets, and you get a migraine for 2 days. And then one of the clinical hints that mold might be an issue is like, oh, doctor, I went on a grain-free diet and I feel significantly better. So that's telling you that's a sign that they might have mold toxicity. Grains are not inherently bad. I'm not against grains. There's a place for them as long as they're balanced and aren't covered with mold toxins. But this is a sign that, yeah, mold might be an issue and they may need to be treated for mold. And, we mentioned briefly that a lot of the toxins can be in the cow milk and stuff like that. So if they feel better going dairy free and grain free, that might be a sign that there's mold toxins. My sickest patients are not able to sweat and not able to defecate. So chronic constipation and lack of sweating is a key sign that detoxification is totally kaput. And then the other thing I see is if people are not eating protein in the diet, there's a limited ability to detox as well. Okay. All right, now we're going to get into the interesting part, all the energetics. Let me just get a sip of tea here. So mold is a yin pathogen and it's very hidden. And one of the fascinating things I see about mold is that when I initially suggest, oh, some of these symptoms may be related to mold, often it's like, oh, there's no way I have mold. I built my house myself. There's no way. And there's just this intrinsic denial that any of the symptoms could be due to mold. And it's part of the energetics because it's a yin pathogen. It's hidden. And it's associated with dampness, right? All of those biofilms it's generating, it's damp producing, right? All of that is dampness and phlegm. And dampness and phlegm will produce muddled thinking and confusion. And there's this clinical befuddlement and perplexity. And it's just fascinating to see that the energetics of phlegm is intrinsic to how the patient presents clinically, and even like just the layers of stuff they'll tell you. So because it's damp and sticky and hidden, people who have mold often get affected with these same things. So they're going to have clouded thinking. You're going to see dampness in them. They're going to move slowly, like getting up off the couch to walk over to the fridge to get a drink is an effort. They're going to have trouble with change and new situations. They'll get stuck in mental thought loops, obsessive compulsive behaviors and thoughts repeating over and over and over again. And they'll often become withdrawn, depressed, and shadowy, all of these hidden aspects. And then, part of how I practice as an amalgamation is I look at astrologically what's going on. And if you look at classical, Chinese medicine, in the Huangdi Neijing, they looked at the stars. I mean, the North Star and the Dipper was very important. And I do think that there is astrology, particularly the Chinese astrology, is part of our heritage. personally, I'm trained in Western astrology, but I do see, I will look at the chart sometimes with certain cases, and I will see correspondences. Neptune, in particular, is he in Greek and Roman mythology. Neptune, Poseidon, was the god of the ocean, and so anything that rules water, and mold occurs in humid places, it can be associated with Neptune. And Neptune causes mysterious illnesses, neurological symptoms, and cloudiness and confusion. It's also associated with these disasters, hurricanes, tidal waves, earthquakes. And I mentioned that after we have a hurricane here in Miami, we often get a lot of homes that develop mold. And it's the sea of the unconsciousness, and it also represents altered states of consciousness. And I do think that mold can definitely cause some befuddlement. The other thing that is, in all of these planetary archetypes have positive and negative attributes, there is a certain merging with divinity that happens with this. That's quite lovely. Pluto, who is also called Hades, is the god of the underworld, and it represents caves or places without light. So often the mold is hidden between the walls, underneath the sink, in the attic, in the rafters, in places where that's not obvious. But Pluto represents transmutation. He's the alchemical planet. It's the ability of a caterpillar to shift its form into a butterfly via a chrysalis, and it's all about rebirth. And I do find that after people are on the other side of mold, often these Plutonian transformations have occurred. And then there's the aspect of Chiron. Chiron is a centaur who's half human, half horse, and he represents the wounded healer. He's all about detoxification and purification and the initiation of heroes. And then, if you look at the energetic symbolism of what happens with mold, often most of the cases come because your house makes you sick. And look at this image here of the tower with the lightning hitting the tower, the people jumping out, and this thunderbolt of lightning just hitting there. And there's this intrinsic upheaval and chaos. And people feel very shaken up once they actually accept the diagnosis of mold, because it hits at a root chakra level, because your home is supposed to be your safe place from the world, but often your home has made you sick. Here's the Chinese medical patterns that I commonly see. And you guys are all clinicians. You know how to pattern differentiate, which is the basis of how you prescribe herbs and acupuncture treatment. So, I'll see a lot of spleen qi deficiency with accumulation of dampness and phlegm. All that mucus coming out when you juice and detox, that's that biofilm, which is phlegm and dampness, literally coming out of the GI tract. Phlegm heat in the stomach channel, that's your pattern for the sinusitis, right? Phlegm heat, phlegm with or without heat in the lungs, sometimes it's cold. Stomach heat with spleen qi deficiency, that's, your weight gain pattern that I often see. They're hungry all the time. They're craving the carbs, but the spleen's not working. Phlegm misting the heart and mind. That's when mold causes either depression, anxiety, or neurocognitive issues. Heart and gallbladder disharmony. So with a heart and gallbladder disharmony, what'll happen, one of the key things I ask is if they startle easily. If there's a loud sound and they want to jump out of their skin, that's a huge sign of a heart and gallbladder disharmony. The other key diagnostic feature of a heart and gallbladder disharmony pattern is early awakening. Like, the alarm's set at 6:30, but they wake up at 5:45. Waking up at 5 o'clock in the morning, that's a classic heart and gallbladder disharmony. And then I'll see stagnation along the whole actual channel of the gallbladder, because mold really affects the gallbladder. And we'll talk about biliary issues later. Liver, blood, and kidney essence deficiency. When you're colonized with these things for a long time, it does hit at the liver, blood, and kidney essence level, especially when you're dealing with carcinogens like ochratoxin, right? Carcinogens are in essence toxin. And then you can get heat toxins at the blood level, damp heat in the liver and gallbladder, and liver fire with all the irritability. So again, see no evil, speak no evil, hear no evil. Here's your cute little Buddha, guys. There's intrinsic denial with mold. That's a common psychological pattern. If somebody denies mold, I never push it. I always just give a clinical suggestion. And then if they come back again 3 months later, they're like, Doc, I'm not any better. I was like, well, how about testing for mold? I offer it again. I never pressure anybody. But often there's worry, overthinking, pensiveness, obsessions and compulsions, depression, and an intrinsic part of the pattern is stasis and stagnation. Things are stuck, they can't move because that yin has become so static, it's just not moving. And often because the gallbladder is so affected, there'll be poor choices or inability to make decisions. You'll know that they have a gallbladder problem because they'll call the office and they can't even decide when they want to come in for that appointment. That's a classic sign that you need to treat the gallbladder. And then, resentment and bitterness can go with this, and all of the irritability, anger, and frustration because they don't understand why they're not getting better. All right, so this is my break here. Do we have any more questions? Let's see. I'm going to open the chat here. Can UV radiation kill the mycotoxins? Yes, UV radiation can kill just about anything, but I don't think it. Oh, mycotoxins, not mold. Okay, so here's the thing. UV radiation can definitely kill mold. I don't know about mycotoxins. That's a good question. One of the things that I found with the mycotoxins is I know ozone can basically denature the protein, but I'm not sure about UV radiation. I will look into this. This is a great question. Will we expect to see hypothyroid and adrenal deficiency in all cases? No. Every case is unique and different. Some people will have, hypothyroidism and a full-on, Hashimoto's thyroiditis and adrenal exhaustion. But some people may come in and they've got insomnia, anxiety, and it's more fiery patterns. So if you think of the Chinese medical pattern, hypothyroidism and adrenal deficiency, all of that are deficiency patterns often. But sometimes you see an excess pattern. Sometimes you'll see liver fire coming in and stuff like that. So not everybody is affected by mold toxicity in the same way. We all have unique constitutions. I think that sometimes what happens is you get exposed to different molds and different mycotoxins, and they all have different effects in the body, which we will discuss. But then there's also, constitutional differences between each of us. So some people may tend towards hypothyroidism and adrenal deficiency, and others may not. Okay. All right, Janice, I'm glad you're enjoying this. Could we please do a short break every hour? So we have the breaks blocked off, but yeah, we'll definitely take breaks. All right. Yeah, and we'll take a break very soon. I'm glad you're enjoying it and that you don't want to miss anything. Okay, Dr. Paul E. Robbins, what test do you suggest to order when thinking that there is a mold issue? Dr. Paul, you are psychic. That is our next section. We're going into that soon. We are going to discuss that later, how to test for mold and mycotoxins. Gina Sanchez, what do you think about long-term consumption of tempeh? It's made with a fungus that is said to be a mold. Are some molds safe? Koji mold is used to make Asian food. Well, here's the thing. I think some people are fine eating moldy foods, and other people get very sick from them. I find though, while molds can be in foods, Most of my patients who get sick are sick because of a water damaged building, not because of mold in foods. I think that there's a lot of mold in foods, and we're all exposed to that, but I don't get concerned about mold in foods. Now, some patients, because of how sick and how sensitive they are, they need to go on a low mold diet for a short period of time while they're treating mold. But I think that, a lot of foods are made with mold. Things like kombucha is made with mold. Cheeses are made with mold and that kind of thing. So not every mold is going to make you sick. And there's certain certain molds that are actually pathogenic and harmful, and others that are safe. And it depends on the person. So, for example, Saccharomyces is a yeast that is used to make bread. It's used to make beer. If 85% of Crohn's patients have Saccharomyces antibodies, so a lot of them do better not having foods that are made with yeast. But a lot of people, bread and beer were eaten by our civilizations for centuries. So a lot of people are fine consuming Saccharomyces. So it really depends on the individual, how sick they are, what level of toxic burden they are. Okay, Peter Shark, you mentioned that 25% of people don't make antibodies to mold. Then will these folks come back negative on immune tests for mold, even when they're sick with mold illness? Correct. That's what I'm seeing. And that's a very insightful question. And so this is one of the reasons why I don't use personally my mycolab testing, because a lot of my patients are not able to generate the antibodies. A lot of my patients also have immune deficiencies, and we will look at that briefly. I see a lot of patients with IgG subclass deficiencies, and when these people are sick with anything, generating an antibody response is difficult. What was the ENT doctor who treats mold in the sinuses? His name is Dr. Dennis. He's in Atlanta. And if you Google Dr. Dennis mold Atlanta, Dennis is his last name. You'll find Dr. Dennis. He's a lovely human being. And yeah, can we mimic, or are they the cause of disease? I'm not sure how to. I'm not sure how to interpret that question. Maybe you can retype that question. Okay. That's correct. Not all molds produce mycotoxins. Okay. Aaron, okay. Okay, so one more question. On the talk about food, how do regular edible mushrooms interact with mold mycotoxins in the body, including some of the adaptogenic mushrooms like lion's mane, reishi, chaga, etc.? So, Aaron, I've clinically seen patients who are very sick with mold react very badly to adaptogenic mushrooms. I've also seen patients who are very sick with mold actually developed immune reactivity to like psychedelic mushrooms. Like they told me, oh, I did this shamanic ceremony, everybody else was great, and I got really sick. This is an interesting question. I think sometimes what happens is when you're sick with mold toxicity, you have to stop all mushrooms. And I've had to alter Chinese herbal formulas where you don't put in fu ling and whatnot, or because the patient is so reactive to mushrooms. Now, other people do fine with it because we're dealing with different genus and species. So yeah, Aspergillus is a genus, and Candidiasis is a genus, and so it even though we're within the fungal kingdom, there may not be cross reactivity, but sometimes there is. And what I'm finding is that each individual is unique and different, and we don't really have a test for that. I often have them try it, and if they get worse, then stop it and take a break. Can zeolite capture the mycotoxins? It does with some mycotoxins, but not all. All right. So how about we take a 15-minute break? It's now 11 after. Shall we come back at 26 after the hour? Is that okay for everybody?
That sounds good, Dr. Rao.